performed a research study called the EAGER study, which was simply looking to see if we can improve the patient journey for those patients that are having a commonly performed heart procedure called a coronary angiogram or a stent.
The aims of the EAGER trial were to compare the technical success rate of two different commonly used guide wires. One of them that's used first line and has been used for many decades and used in a different procedure where it was traditionally used through the groin, and compared to one that's more been designed to go through the wrist artery or radial artery, which is what we use more commonly nowadays.
The pathway to the heart these days is typically done from the wrist, the radial artery. And in men, the typical size of this vessel is bigger than women because they have a larger size. So for the average woman, the artery might be 1.5, perhaps up to 2 millimeters in diameter. The wire that we use hasn't changed, and it's traditionally used for all patients, men and women, and it has a 3 millimeter tip.
The outcomes pleasingly demonstrated a greater technical success rate going through the wrist using the smaller, more narrow tipped wire called the baby J wire, which was particularly noticeable in women.
We found that the passage was a lot more straightforward and was less complicated by things like pain related to irritating the artery. The thing I'm most proud about is the collaboration and the team-based nature of the work. And now we're presenting our data on the world stage, and with a simultaneous publication in a leading journal is really gratifying.
I had the opportunity to present these findings at an international meeting and talking to some colleagues from around the world. A number of people have started using it. This gives some great data that there is excellent benefit to using this smaller narrow-tipped wire, and that we should tailor our approach depending on the person, particularly for women, for example.
Our project started off the basis of opioid overdose being a huge public health issue internationally, but also nationally. And we really wanted to get an understanding of how it was impacting our frontline emergency department and how many presentations there were across both emergencies, Gosford and Wyong Hospital, over a 2-year period. Once we had an idea of the number of patients that were getting discharged following an opioid overdose, we then sat down and looked at how we might be able to create this opportunistic intervention.
Take-home naloxone provides the drug naloxone, or the program provides naloxone, which is a nasal spray for people who may be experiencing an overdose, or a bystander can also use that nasal spray. Administered into the nose, easy to use, saves lives.
We will be monitoring the whole project in real time. So every day we'll be seeing if any take-home naloxone was dispensed in the last business day. And if there was, we'll be doing follow-up safety phone calls for those patients who received it. And we're going to monitor it at intervals every 3 to 6 months. And within 1 year, we should have a really good idea of how much this intervention is being taken up.
With this project, it's the first of its kind. There's no other in New South Wales. We're the pioneers, and we just really want to provide that easy access to patients that need it in the community.